Hello, my name's Ian Sinha. I'm a consultant respiratory paediatrician in Alder Children's Hospital in Liverpool. And thank you for watching this video. My video is about health inequalities and childhood asthma and what we as healthcare professionals should think about in terms of this important aspect of healthcare. The first thing to think about really is that health inequalities exist and that these are very well established and deep rooted and deep seated. And it's very timely to think about these at the moment with the current cost of living crisis. But we need to be very careful when we think about this as an acute crisis, because it isn't. People have been struggling with money in the UK despite being such a rich economy. There are huge numbers of children living in relative poverty. Around 1 in 3 children in the UK lives in relative poverty, and the impact that that has on their health and their lives and indeed their asthma is profound. When we think about the current cost of living crisis and the pinch that people are feeling, what we're really seeing is not just a problem in terms of their income and their outgoing, but also their wealth. In other words, the money that they don't just have in their pocket or not have in their pocket, but the money that is or isn't in their piggy bank. And that's because when we hit times of financial hardship, it's important that we have something to fall upon. And we know that the poorest families in the UK, and by that I mean the poorest third of the UK, have very little in terms of savings. Why is that relevant to asthma? Well, it's relevant because we know that having a child with a chronic illness such as asthma is a big financial hit for families. And we need to think really sensitively about this as we move forward. In terms of what we as clinicians might see as the manifestations of poverty in children with asthma, we might see children with quite severe asthma, or we might see children whose symptoms or exacerbations are disproportionate to what we might expect. And when we think through the reasons why that might occur, it gives us some opportunities to address these in the clinic. The first thing I think it's important to ask about is air quality, both in terms of indoor and outdoor quality. Housing, social housing in particular, and private rented housing are of a very variable standard in the UK. And when we think about, for example, big cities like London, we know that the housing costs are so high that people take what they can get. And therefore, they're often left in a situation where there is damp, dust, or mold in the house. And overcrowded housing is a massive problem for people. We know that viral infections are a big trigger for asthma attacks in children. And one of the key drivers for this is living in an overcrowded house. So it's very important that we ask about housing quality, and obviously within that, asking about smoking. But outdoor air pollution is also very important and contributes significantly to the asthma burden that people face. And air pollution doesn't hit us all equally. We know from UK data that the poorest communities, and particularly those with high levels of Black and Asian people, are especially vulnerable to high levels of air pollution as well. So it's important to ask about living near main roads, and it's also important to ask about industrial air pollution. For example, if we look in parts of London, like Southall, there are tarmac factories, there are incinerators, there are busy roads. All of these things lead to quite toxic chemicals in the air, which can be quite damaging and irritating to children's airways. And when we look rurally, we see problems with things like landfill sites, for example, which can also be a trigger for people with asthma. The next thing I think it's important to think about is nutrition. I'm sure many of you will recognize that in our clinics, certainly compared to 25 years ago, we're seeing higher rates of obesity. And that's important in asthma, and it's important when we think about poverty. The rates of obesity are rising quite dramatically in the poorest quintile of the country, and are in fact getting better in the richest quintile. The gap is widening. And one of the reasons that that impacts on asthma is that being obese itself makes it more difficult to breathe. It makes children more prone to having symptoms of asthma. Within that, we know that the kinds of foods that the poorest communities are limited to, for example, ultra-processed, high-calorie, high-salt, high refined sugar foods, are in themselves pro-inflammatory and therefore can make asthma worse. So it's important that we ask about nutrition because this can be an important driver for asthma. Now, when we think about these things, about housing quality, nutrition, how much money people have, they might seem like sensitive topics, but it's important that we ask them. If any of us as adults went to ask a doctor for a checkup because we had a respiratory problem and they didn't ask that whether we smoked or not, we'd probably feel a bit shortchanged. And this is important because the key drivers for health, the very core drivers for health, lie in social medicine. And even when we think beyond what we can ask people, we can start to think how we set up our services to minimize the burden on families. The average clinic appointment in Liverpool, where I work, the average clinic appointment costs about 30 to 35 pounds per patient. And that becomes very unfeasible and unsustainable. So when people are attending our appointments, it's important that we recognize that they've made a sacrifice to do so. They've chosen to come to that appointment in place of doing something else. And if we can set up systems whereby we can make that easier for them or minimize the burden that they have, I think that goes a long way. But it's also important that when they're there, they get the best quality care, which I'm sure everybody's doing, but it's really important that we get the basics right. The answer to health inequalities in asthma lies in two things. It lies in making the social constructs of the country better and more robust so that children aren't in poverty and that poverty has less effect on their health, but it also rests on excellent healthcare. And that's why one of the themes that I'm sure you'll be aware of is the importance of checking inhaler technique and giving out written asthma plans so that people know what to do if their children have an asthma attack. Thanks very much for watching this video. I hope you found it useful, and I look forward to catching up with the other content on this excellent set of resources. Thank you.